conventional medicine for decades or for generations has been doing one particular mindset around osteoarthritis, which we're learning that mindset, that understanding isn't necessarily true, and it's not necessarily accurate. I'm noticing that I'm really small here. What's going on here? I think I need to go like this. Bear with me 1 second, people. I think once we get these things sort of fixed up, we'll be good to go. Appreciate your patience and bearing with me. All right, now that's what we okay. Go there and go. Okay. All right, I think that's much better. You can probably actually see my face, so we're having a conversation with one another, so to speak, and we can get started here. So the basic idea is let's just jump into it. I made slides because it gives you some visuals and it helps me stay on track. I'm going to speak for about 45 minutes, and it might be a bit longer than that, and it might be 45 minutes. We'll see how it goes. I'd like to have there be some time towards the end for questions if people want that. And let me just make sure I can read the questions. All right, great. Thanks for your feedback. Those of you who have shared that it's visible. So we're going to talk about very briefly about what is osteoarthritis and just a little bit about how big of a problem it is and how it's probably not what you think if you've taken in the idea from last century's understanding of osteoarthritis, which is still what's going around among most doctors. And we'll talk about what really is going on. We'll talk briefly about the bad way to deal with it, and then what you could do if you want to be proactive. And let's just jump into it. You know, arthritis is joint pain and inflammation. I'm going to go pretty quickly through some of this. Don't worry about it. Get the basic ideas. But osteoarthritis can happen in any joint in the body. We give it different names sometimes, like spondylosis or spondyloarthropathy or whatever. But the point is that it's a certain process of degeneration of cartilage. And the cartilage breaks down. Instead of being nice and smooth like it is on the left side of the slide, it gets gritty and cracked, and different things can happen to it. And that's part of what generates the pain. But the pain's much more complicated than just the cartilage loss. So we call it degenerative joint disease because the joints break down and degenerate. And it's painful. There can be loss of function. There can be, for some people, a spiral of weakness and dysfunction. And then there's other illnesses that go along with it, because people with osteoarthritis are much more likely to have cardiovascular disease, depression, anxiety, diabetes, stroke, dementia. And we used to think that was just because, well, it's a disease of aging. But what we're learning is that there are underlying physiologic imbalances and principles that are generating all these different diseases. And it's the same underlying stuff. And that's one of the innovations of the functional medicine approach that I'm going to share with you a bit about today. That's part of what's so exciting to me, is because we're finally in a time where we can really try to get at root cause of some of these difficult things, where previously medicine was just really about, treating the symptoms. And that's how most of osteoarthritis care still is in many cases. So this is a map of the incidence of osteoarthritis, starting in 2005. You just see the numbers increasing with literally millions of people in America. This is a line going up, and we're looking at projecting in the the 2030s like 70 million people. It's a huge, huge issue as our population ages. And so this is what we used to say, and this is what they taught me in Duke Medical School and Harvard Medical School. Overweight people are more likely to have osteoarthritis, and it's because overweight people are heavy. Obesity, increased weight makes more wear and tear on your joints, and that's what causes OA. So you should lose weight. And that is just not true anymore. This was from Mayo Clinic. I looked at this about 6 months ago, and basically they said the same thing. Mayo Clinic website, osteoarthritis is caused by wear and tear on the joint over time because of overuse. And that's not true. We've got 20 or 30 years of science showing us a different picture, and medicine is conservative and slow and doesn't respond to new stuff. But I want to share a picture of why it's important and we do think progressively about this. So that's old stuff. Really, there is this holistic integrative process of multiple factors, and it's a systems biology thing. It has to do with all the underlying biological systems that are interacting with each other. Osteoarthritis is not just wear and tear on your joints. Osteoarthritis is generated when your body has a pro-inflammatory state, when there's potential toxicity, mental emotional stress, immune changes, and indeed mechanical stresses are important, but it's in the context of these other factors that drive the process. Of course, genetics are part of it too. Um, I mean, to me, this talk is important for anybody who has osteoarthritis and is suffering from that and wants to know what to do. But also, if you've got a family history of arthritis, if your father or mother had a lot of arthritis and had a lot of issues with that as they got older, it could be that you have a genetic predisposition. And if you're a proactive person and you want to go forward and live well and stay healthy as long as you can, you should absorb this knowledge so you can make the right choices. So the core of what we're seeing in the past, say, 20 years in the research is that brain-gut immune interactions are part of what drive joint generation. So osteoarthritis is not just wear and tear, that there's brain-gut immune interactions that create low-grade inflammation and what we call cellular stress or oxidative stress, and that's what leads to the breakdown of the joint. And these are places that we can work. We can work on the brain-gut immune axis with certain lifestyle approaches. And this is another picture from seminars in arthritis and rheumatism that's painting the same picture. And this is a famous scientist at Rockefeller University who's talking about the gut-brain axis and the fat-brain axis, because adiposity or extra fatty tissue is important, but it's not because of the weight. Extra adipose tissue creates a pro-inflammatory state. It creates an oxidative stress state, and that's part of what drives osteoarthritis. And so the joint CNS axis, the sort of chronic low-grade inflammation aspect of it, the adiposity aspect of it, and the gut-brain axis are all part of it, and it's all organized by the central nervous system. So this is a holistic integrative process: brain, gut, immune, joint. So let's really focus on this a little bit. This just explodes a bit, the gut-brain immune axis. This is like a picture of the inside of your intestine. And here's the inside of your gut, which is full of food particles and bacteria. Here's this big nerve called the vagus nerve going from your brain to the gut. It's your relaxation nerve. Maybe you've heard of vagal tone. So stress changes the way your gut functions. The actual biochemistry, the neurochemistry, the inflammology, what's going on with all the inflammatory molecules, that changes the biome, the microbiome, the trillions of bacteria living in your gut. You've got multiple things changing that are all interacting with each other. And then they interact with all of the systems of your body because you're one unit. It's not like your bones or your head and you go to conventional medicine. This is the way I was trained. You go see a different ologist for each of the kinds of problems you have. And if you've got, memory difficulty or problems with your thinking, you go to a psychiatrist or a neurologist. And if you've got diabetes, you go to a diabetes doctor. And if you've got osteoarthritis, maybe you go to an orthopedic surgeon or a physiatrist. And if you've got problems with your liver, you go to a liver specialist or maybe a gastroenterologist. But really, we've got underlying issues in the brain-gut axis, brain-gut immune axis, that generate all these different problems. So in functional medicine, we aim for the core. This is a schematic, a close-up of the gut. And on the left side, you see how the cells are all held together tightly. We have these things called tight junctions, which control what comes across the gut barrier and into all of the blood vessels that surround your gut. Your gut is like, if you spread it all out, it's like the size of a ping pong table. It's a big area. There's a huge amount of immune surveillance. The immune system is like sentries at the gate looking for bad guys coming across. So if the gut barrier is not regulated appropriately, what happens is that you get particles of food, you get little bits of bacteria, you get proteins and other stuff that's not supposed to cross over and access your bloodstream. And when it does, the immune system gets aroused and excited. And that's how changes in your gut can create systematic changes throughout your body. And that can affect all of your bodily systems. It's really an incredibly rich, fascinating picture. And I wish I knew about this when I was in medical school, but we keep learning, hopefully. Okay, so taking a breath. What next? Oh yeah, like we touched on this before, but when the gut-brain axis gets off, we have changes in sex hormones, inflammation, cellular stress, the way your body processes pain. It can affect mood and contribute to an anxiety and depression. It can affect your behavior. Uh, it can affect so much about your life. And so that's why it's so important to have a proactive look and address these things from the inside out. These are some of the diseases that have been shown to be associated with gut-brain immune changes. And I talked about all the allergists working on all their different diseases and end organ problems. But when you look in the specialty journals of psychiatry and neurology and orthopedic, you look in all of the specialty journals and they're all talking about gut-brain immune interactions. But it takes a long time for that to get to the average doctor who you see in the clinic. And maybe that's why you're here. I want to add something about this brain-gut immune interaction, which drives all these other chronic medical problems, which is that your autonomic nervous system, which maybe you know about that, that's the combination of your fight, flight, freeze reaction and your rest and digest reaction, your stress response, your relaxation response. When you live with an overactive autonomic nervous system, because of trauma, because of pain, because of anxiety, because of all sorts of things that can lead your system to a hypervigilant state, it puts this whole process of disease generation into overdrive because it pushes forward on the gut-brain immune interactions. Your autonomic nervous system, your fight, flight, freeze response, it's your danger response. It's what helps you fight against external dangers and problems. And your immune system does the same thing, which is part of why they're so integrated with each other. Because when your autonomic nervous system is activated towards a stress biology, your immune system is activated in that way too. And so that drives the whole process. So just kind of summing up, what causes osteoarthritis? Yes, it's mechanical stress like the average doctor still thinks, but it's also dysbiosis and leaky gut. It's systemic immune changes. It's autonomic imbalance where the fight, flight, freeze reaction is overactive. It's biochemical stress, which leads to what we call mitochondrial stress. Mitochondria are the little organs in your cells that make energy. A lot of people who develop chronic disease also find they're fatigued a lot, whether it's osteoarthritis, fibromyalgia, autoimmune illness. Like, I feel so tired all the time. That's because the immune system's revved up. It causes oxidative stress, and it makes the cells kind of shut down their energy production. Okay, so let's keep going forward. So what to do about it? We want to reduce pain and improve function, and that's where conventional medicine is focused. That's where I focused for most of my career. But then there's this aspect of how do we slow or stop the disease process? So as we go forward over the next, 30, 40 minutes, we're going to talk a lot about reducing pain and improving function and contrast the conventional old school approach with the modern approach based on fundamental new research in terms of reducing pain and improving function. But the interesting thing is that a lot of the new things that we use that are nutritional, that have been shown either in the lab or in people to reduce pain and improve function, also slow or stop these processes that drive osteoarthritis. So that's kind of good news, and I'm really excited about this. So this is what we used to do. like medications like Tylenol and anti-inflammatory drugs, advice to lose weight, injections, physical treatments, and these help to a certain extent, but none of these things slow or stop the disease process, except if you lose a large amount of weight. And that may well turn down the disease process, but not just because you're less heavy, but because it shifts and changes this whole biological process of low-grade inflammation. So this is the problem with conventional approach to it, which we've got various drugs and interventions, but they don't really stop the process. So let's unpack a little bit of what the problematic issues are. You might already know some of this, right? So no evidence for changing the disease, and they might worsen it. That's the problem with a lot of the conventional approaches. We know that there's toxicities from medication. The main thing I want to focus on here is the NSAIDs, the non-steroidal anti-inflammatory drugs, the simplest ones being like ibuprofen and naproxen. There's a lot of different NSAIDs, and there's the old kind of NSAIDs, which we call non-selective, and the newer ones, which are supposed to focus in on a particular enzyme and bother the gut less. And it's a great idea. And so those newer drugs like celecoxib or Cellcox or I forgot what else they call it, the various trade names for it. But that drug doesn't cause as much bleeding from the gastrointestinal tract. But the underlying process by which NSAIDs cause leaky gut still happen with those selective newer NSAIDs. So there's actually been research not only just showing that can be kidney problems and cardiovascular problems from these non-steroidal anti-inflammatory drugs, but worsening joint inflammation. And there's been research showing that, and this has been for decades, like since the 1990s, there's been research showing that NSAIDs cause leaky gut. That thing where the gut gets leaky and it creates systemic inflammation. So it's this very ironic thing, which is that you're taking an NSAID to reduce inflammation and pain, but in the long run, NSAIDs are increasing inflammation and making the disease process worse. And as they've gotten smarter about making trials, clinical trials for osteoarthritis, they've shown a few cases where even medications, where NSAID medications actually hasten, they make worse the narrowing of the joint space. And that's how we measure how well the osteoarthritis is proceeding and if it's whether actually it's getting worse or not. When osteoarthritis gets worse, it makes the joint space narrower because the cartilage breaks down and goes away. NSAIDs make the process work so the cartilage gets narrower because the process gets worse. Okay, so what can we do about it? And how do we think about this from a progressive modern point of view, thinking about natural things that you can do that not only address the pain, but actually help with the disease process itself. And I'm going to unpack some of these and we're going to look at some research together, kind of a overview, a kind of preview of it. And then I'm going to give some more specific suggestions about, okay, here's what you should do. Okay, so healing the gut biome and barrier, that's hugely important. That's a big process. We're not going to dive into that because it's such a complex thing. But the right diet is big. We'll talk a little bit about that. Like what kind of diet helps slow osteoarthritis? We want to reduce inflammation and support detoxification pathways, which are involved in inflammation. And there's a bunch of nutrients that have been shown to have benefit in osteoarthritis. Simple things like magnesium and vitamin D and the certain B vitamins, but then more specific agents like omega-3 fatty acids that they find in fish oil, or collagen, which is like a molecule. You can take powdered collagens, and there's a whole family of molecules called polyphenols, and you've maybe heard of curcumin, boswellia, pignenolol, green tea. These things have activity against the process that drives osteoarthritis. So we'll unpack that. Mind-body healing is huge. We'll talk more about this towards the end if we have time, but exercise is also really important. Okay, I need a little bit of green tea. Got to wet my whistle sometimes. Okay, so let's go forward. So most of conventional medicine would say that these things are experimental because the amount of research that we have available to prove that they work um, isn't as much as we'd like to. And there's reasons for that. But the research we have is very suggestive. And the research we have about a lot of these nutritional and natural approaches to osteoarthritis that reduce pain and improve function also seem to address the disease process and slow or stop it. So I hope you can see that's a completely different paradigm than the conventional approach of taking medications to block the pain and getting injections to get you out of a pain flare and then eventually getting joint replacement surgery. I want to keep people out of the operating room. I want to make it so that more people don't have to have joint surgery, so you don't need hard drugs to reduce the pain. And there's ways to do that. So here we go more. So let's talk about diet for a second. And there's been a bunch of big research studies that have, they're not big by cardiologic standards because it's really hard to study diet. It's hard to make sure people keep track of what they eat. So from a rigorous science point of view, a lot of doctors are like, oh, this dietary stuff, it's not such great research. Okay, but what are you going to do? Diet usually isn't dangerous, but drugs are. But the key findings, and this was a meta-analysis of a bunch of different studies, a systematic review, that people who ate more of healthy fatty acids like fish oil and polyphenols did better. Diets that were higher in plant polyphenols, we'll talk more about that, omega-3 fatty acids, tended to have less pain and better joint function. And that people who took refined plant foods like processed stuff and used unrefined plant foods also tend to do better in terms of joint function. So this is a direction to go in. And, this is summed up. Well, let's keep going here for a second. So there was also research, and again, this is from a big study. This wasn't from a meta-analysis, but high intakes of total fat and saturated fat was associated with more progression of osteoarthritis. But then monounsaturated fat and polyunsaturated fat, like olive oil, like fish oil, like some other oils, those actually decreased the progression of osteoarthritic disease. So this is simple stuff. This is like adding more olive oil, eating more cold water fish that's sourced in a good place, eating less unhealthy fats like red meat. So greater intake of saturated fat over 48 months was associated with more reduction of the joint space. The cartilage was wearing away. They were losing cartilage from eating red meat and other saturated fats. It's amazing, right? So when we think about diet, what should the goals be? Well, you want to lose weight. You might want to lose weight. You definitely want to reduce inflammation and increase your antioxidant capacity. Because remember, it's inflammation, oxidative stress, and then cellular breakdown. So high fiber, lower simple sugars, whole grains, high polyphenols, we'll talk about that in a minute, and then healthy fats like extra virgin olive oil, cold water fish, salmon, mackerel, sardines, and some nuts and seeds, and less red meat. And so maybe you've heard of the Mediterranean diet. The Mediterranean diet has been shown in studies to improve pain and function in people who have osteoarthritis. When you're thinking about diet, it's complex. Behavior change is complex. And if you can put a label on something and say, okay, this is the diet I want to follow, then that could potentially help a lot. People have looked into other diets. There's a lot of diets out there. I want to focus just on Mediterranean diet because it's a box, it's something you can grab onto. You can go and say, how do I do a Mediterranean diet? And you can do it. It's a time-tested thing. Some people like things like paleo and yeah, it's complicated because you eat a whole bunch of protein, but it's saturated fat. You have good things happen. You have more energy. It helps with blood sugar control. You might lose weight, but you're eating saturated fat. It's not balanced. It's not long-term. Mediterranean diet is like human intelligence, cultural intelligence for decades and centuries has given rise to Mediterranean diet. And people live a long time when they eat this kind of food. So that's what I encourage my patients to do. And so This was a big review of other studies. And the main thing I want to circle here is that the Mediterranean diet, and they looked at things like pain and function and ability to get up and go and walk, knee and hip range of motion, improved with Mediterranean diet. Overall pain improved with Mediterranean diet. Joint disease progression improved with Mediterranean diet. There was less joint space narrowing and decreased prevalence of osteoarthritis over time and decreased inflammatory markers. So what kind of diet's the best diet for osteoarthritis according to the research? The Mediterranean diet. Got it? Okay. I want to make that clear. I wish we could talk about this more live. So there it is, Mediterranean diet. All right, so we talked about polyphenols. What are polyphenols? Polyphenols are the things that make food colorful. Polyphenols there's a whole bunch of things here that have been proven in research, that they inhibit inflammation in the body. How does inflammation work? So you got tons of molecules that are all talking to each other, and these cells are talking to these molecules and these cells, and that's how inflammation happens. So polyphenols block those processes. They turn off important inflammatory processes. They decrease oxidative stress. They gobble up free radicals, which cause cellular damage. Free radical damage from oxidative stress drives inflammation, which creates oxidative stress. Vicious cycle. Polyphenols slow that cycle. Reduce pain signaling. Pain is not just a light switch. Pain is worse with inflammation and oxidative stress. Oxidative stress and pain and inflammation hype up the nervous system and turn on the volume on pain transmission. So polyphenols turn that down. I guess we already talked about decreasing inflammation and all these biological processes that they've measured when cartilage is breaking down. Polyphenols start to block that process, which is part of why they're probably so helpful. And so polyphenols are all the colorful food. We got carrots and lettuce and green and tomatoes and beets and avocados and broccoli and everything colorful. And of course, don't forget about those berries, raspberries, blueberries. Everything that's colorful is good. I could talk about organic versus non-organic, but that's a whole other topic. It's actually potentially important. Okay, I hope this isn't too overwhelming for people. Let me know in the chat if there's any crazy difficult things that are making it difficult for you to follow up. I hear one person doesn't want captions. I'm sorry about that. So polyphenols, we talked about that. And the big ones that we see in the research, the ones that get research attention, are curcumin, which comes from turmeric. It's a root. Boswellia is also a root. There's also green tea, pygnogonol, which comes from pine, silymarin. I'm not sure where that comes from, but it is an amazing substance that helps the liver detoxify, and it's also a polyphenol. And resveratrol, that's a typo there. It should be an O instead of an I. But in any event, that's what comes from grape skins, red grape skins. So I found one review, right? Oh, wait, hang on. Let me just go back here for a second. So mainly I'm going to talk about curcumin and boswellia, but there was one review of all of these things as a lump. I want to share one research issue, right? Which is that there's something called the WOMAC, which is the Western Ontario McMaster Index. And that's like the most popular, reliable, used scale that they do osteoarthritis research with. Because, you don't want to just do stuff. You want to measure it and see what works and doesn't work. And so the WOMAC has 3 scales. There's a scale for pain, a scale for stiffness, a scale for physical functioning. These are some of the details. And the person checks off the boxes and lets the research know how severe or the issues are with all these different domains, and they get an overall score. And it's shown to be pretty sensitive and pretty specific, meaning when you get a high score, it means you got a lot of osteoarthritis, and a low score means you have less, and it means you're functioning better. So that's how they measure it. That's one of the ways. So the main 2 things are pain scores, out of 0 to 10, how bad is your pain? And then the WOMAC. And that's how the research tends to measure stuff. So let's think about it. And, this is that general polyphenol thing where they looked at green tea and pygnogonol. I can't even pronounce it, whatever. Pygnogenol, resveratrol and silimar, and they looked at them together as a group. And most of the studies were like 6 to 10 weeks long, which isn't very long in osteoarthritis. And they showed benefits. So these things probably are good. Does that mean you should drink 10 cups of green tea a day and eat pine needles? Probably not, and definitely doesn't mean you should drink a lot of red wine because it's got resveratrol, but it means that these things are useful. And if you can build them into your diet, it can be a positive thing, because what they generally saw compared to placebo was better pain relief, more functional improvement, no difference in safety outcome, and they did seem to do as well as NSAIDs. That to me is a shocking thing. We're going to see that over and over, that these polyphenols seem to work as well as NSAIDs in reducing pain. So let's talk about curcumin. This was a big meta-analysis of meta-analysis. They looked at all the research. They did a big, what's a meta-analysis? So research is complicated. It's really easy for research to come up with results that aren't really reliable or applicable. And so a meta-analysis is when they take a bunch of different research studies and they pool all the data together and try to look at it together. And that's why it helps to have consistent measures like visual analog pain score and WOMAC, because what they do is let them compare results in the studies. So they take a bunch of studies and they look at the data together, and that it helps you see if there's bias. It helps you see if those results are durable and reliable. And it's very useful. If you get positive results in a meta-analysis, there's a very good chance that there's a positive thing going on there. This was a meta-analysis of a meta-analysis. So it's a whole other level of rigor in trying to sort out what's really going on with curcumin, and great benefits. Benefits in terms of overall pain scores, the total WOMAC, functional scores, pain and stiffness. It was great stuff. Curcumin helps a lot and reduces over other medication usage. We'll talk some more about curcumin because it's such an interesting molecule. I'm so into curcumin. It's like a magic thing. It's a gift. We're still on curcumin. This was another meta-analysis. Basically showed the same thing. I'm not sure if we needed to see this. This author, the main reason I put this here is because the results from this meta-analysis suggested, look, you probably need 3 months of usage to see the full benefit, because what we're talking about with curcumin is frequently not just a reduction in pain and stiffness and function and improved function, but some evidence that it affects the overall inflammatory picture, which can affect the pain processing and affect the joint breakdown and so many other aspects of it. So the duration of usage can actually have a significant difference. So here we go, exactly that. Potential disease-modifying effects of curcumin. And this is other research that looks, laboratory stuff, where they're giving certain amounts of curcumin into cell cultures and sometimes measuring it in people's body, in their blood. Inhibits inflammatory chemicals that are really important for driving inflammatory signals. Inhibits the oxidation process by gobbling up free radicals and improving the body's antioxidant activity, and promoting healing of the cartilage itself. The cartilage is alive, right? You have two bones and you've got this matrix of cartilage, and it's meant to be constantly rejuvenating itself. And part of the disease process in osteoarthritis is the cartilage gets sick and it stops rejuvenating itself and it starts to break down. And it looks like curcumin helps the cartilage regenerate. So that's huge. Like, no one would even think that about any of the previous drugs we used to use. So yeah, we could do a whole talk on curcumin because there's all these other applications for it. It's really quite an astonishing molecule. Okay, let's go to boswellia, which is also frankincense. And this was a systematic review that looked at 1,000 patients. And, they weren't big studies individually. It was a bunch of small studies. And, researchers frown upon that because you want to get big studies because the results can sometimes be better and more generally applicable. But they looked at curcumin and boswellia, and both of them did great stuff. They didn't find any differences between curcumin and boswellia, but they both did better than placebo. And this is more about curcumin, that when they compared the effect size in these studies of curcumin versus placebo to the effect size, this is a statistical thing, comparing them to NSAIDs, it looked like curcumin had a better effect size than the NSAIDs, which with less side effects and the potential to actually help the body rejuvenate rather than further degenerate So, I know what my choice will be. My dad and mom had significant osteoarthritis, and I've got the beginnings of it. So that's why I'm getting hot and bothered about osteoarthritis, because like it's facing me, like I've been treating people with all sorts of issues, but I'm getting much more interested in osteoarthritis because it's so personal. It's personal because my dad had all four of his major joints replaced, in his life because of osteoarthritis. So he should, yeah. I'm seeing a note I can't read from here. Right. AIP plus eggs versus Mediterranean. That's a great question. Yeah, it's so complicated. What a wonderful question. Someone's sending that question in. So I don't think we can even answer that question. I don't think we know. You know, One of the questions was like, okay, maybe red meat should be part of it because it's better for muscle health. I've never heard anything that convinces me that red meat is better for muscle health than healthy protein and a broad diet. There are like incredible power lifters and athletes who are vegan and vegetarian. So, if you find something that says conclusively that red meat helps build muscle better than diets without red meat, I'd love to see it. I've never seen anything like that. As far as AIP versus Mediterranean, that's not what was studied, in part, I think, because it was newer and there's less research interest. And there's all these like research labs studying Mediterranean diet. And once they're good at it at Harvard or Baylor, they study it in a whole bunch of different diseases. So you get all this research about Mediterranean diet and you don't get as much about AIP. Does that mean AIP isn't as good? No, it means we don't know. And I think that thought process, by the way, just put it in your head, because, you'll see a lot of doctors who say, oh, I don't see any research to prove that. And the implication is, well, if there's no research, it must not be true. But the logical fallacy there is that absence of evidence means evidence of absence of effect. And that's complete nonsense. There's no logic. There's no science. It's not scientific to say that. People think they're being scientific when they say, well, there's no evidence to prove it, so it must be placebo. That's absurd. It's not scientific to say that. Anyhow, let's go on. There's so much to share. I appreciate your questions. Keep putting them in there. I'm going to scan through them at the end, and whatever juicy ones are there that haven't been answered, I'll try to get to them. So let's see. So omega-3 fatty acids. So this was an interesting run, right? Because this guy, Dr. Felsen, he's one of the big osteoarthritic researchers. He's the granddaddy of osteoarthritis research. I've been watching his research since I was in medical school. He's really a well-respected scientist. He's a good man. But when they studied omega-3 versus omega-6 fatty acids, they made a mistake. What are omega-3 fatty acids? Best sources are cold water fish. There's other places that are looking at producing it from algae and various other sources. And you can find some in flax seeds, but it has to be processed, and it doesn't process as well as the stuff that comes from fish. So that's omega-3. Omega-6 fatty acids comes from grain, typically like mass-produced cultivated grain. So you got to be careful, because if you buy salmon that's cheap farm salmon, the way they feed it is they feed it corn, or they feed it like, not very high quality ingredients. So it doesn't get the omega-3s, because salmon get all the omega-3s because they eat little fish, which eat little crustaceans, with eat little algae. So that's a food chain thing. So you got to be careful what kind of fish you eat. But omega-6, omega-3, it's all been out there. Like, what's the deal? Omega-6 seems to be pro-inflammatory. Omega-3 is anti-inflammatory. And that's where all that interest comes in cardiovascular disease and all these other places about omega-3 versus omega-6. They did this big research study that probably cost $50,000 or maybe more. They took 360 cases of people with osteoarthritis. And another bunch of people who have radiographic knee osteoarthritis, and they found no association between the serum levels of omega-3 or omega-6, and they said there doesn't seem to be any difference. Okay, that's great. There wasn't any difference when they just look at omega-3 or omega-6. But the issue is that the way omega-3 and omega-6 work together in the body. This again is something that happens a lot of modern nutrient research. They look at nutrients in a way that is not consistent with the way your body uses nutrients. There's a ton of examples about this. There's later research where they looked at the ratio omega-3 to omega-6. This is something we measure. In my practice, as I work out of Rose Wellness, we measure the omega-3 to omega-6 ratio. And what that does is says relative to omega-6, how much omega-3 is, and that's what determines the inflammatory tendency of the body. And when they looked at the ratio of omega-3 to omega-6, yeah. So in people with knee pain, a high omega-6 to omega-3 ratio, which means the pro-inflammatory are higher and the anti-inflammatory are lower, that in people who had a high omega-6 to omega-3 ratio, there was more pain and functional limitation. There was more experimental pain sensitivity, like took a person's hand and like poked it with needles and they hurt more. Crazy, right? And more psychological distress compared to people who had a lower ratio, or even better, a high ratio. We measure an omega-3 index, and we want it to be above a certain level. So let's move forward. Right. And now this is a clinical trial because it's great to look at the dietary associations. This is when they actually used it. Okay. And this is a single trial. And basically, when they gave people moderate doses of omega-3 fatty acids, 1 to 2 grams, I'll talk more about this later, but there was a reduction in inflammatory biomarkers, reduction in cartilage degeneration, and a counteracting of the normal disease state of osteoarthritis on a biological, physiological level. They weren't measuring joint space in this study, but I'm sorry, my bad. This is a review. This is an overall sort of discussion of other research. Forgive me for that error. But these are some of the findings they found in all the research studies they reviewed. And then positive effects on muscle tissue recovery to exercise, which is what you need to sort of like strengthen yourself and deal with the dysfunction and the disability that comes from osteoarthritis. So this is all good stuff. It's all stuff that shows that omega-3 fatty acids help the underlying substrate of what helps a person slow, stop, or dysfunction well with osteoarthritis. And this was a meta-analysis of 9 randomized trials with over 2,000 patients. And they compared omega-3 supplementation to placebo and found decreased pain, increased joint function, and no complications or adverse events, and similar overall adverse events compared to the placebo group. So it didn't seem like it hurt anybody, and there was significant benefits across the whole study. So that's cool. And this is another systematic review. I'm sorry, we're leaving omega-3 fatty acids because we got a lot to cover. We're talking about glucosamine chondroitin. This is such an important conversation because, you know, when I was in training, that's when there was a lot of initial research on glucosamine and chondroitin and a lot of positive benefits. And they were using glucosamine sulfate. And then there was this big study in the late 1990s where there was a huge study. It was in the New England Journal of Medicine, and it was almost like conventional medicine was saying, ha, this stuff doesn't work. But they used a different kind of glucosamine. They used glucosamine hydrochloride, which is a different formulation. And it was just such a controversial, bizarre thing to do. It's almost like they wanted to do it differently and show a different result. I don't know. I would think they would have been more informed. Since then, since the turn of the century, most of the studies of glucosamine have been looking at glucosamine sulfate. I think because of that whole controversy that GATE trial brought up, there's a lot of doctors who still talk about it. Glucosamine doesn't work. The GATE trial proved it doesn't really help. It's crazy. It's crazy stuff. Research marches on. You need a lot of research to see what's going on. And ultimately, everybody is their own research subject. Overall, in this systematic review, what they saw was that they looked at both glucosamine, chondroitin, and combination, and found a ton of benefits in terms of chondroitin, improvements in pain, improved physical functioning. Glucosamine showed reduction in joint space narrowing. Again, disease modifying, slowing the disease process with glucosamine sulfate. And the combination didn't show any difference. And that was weird because there's something about when you combine them together, and there's a theory that when you take them together, they compete for absorption. So this is interesting research. If you're going to take both of them, take them at different times of day. And the miscellaneous nutrients, I'm not going to unpack research studies on this, but just to share it a little bit verbally, like there was a big study that showed that people who have lower magnesium levels have more osteoarthritis. Magnesium is a hugely important molecule. There's research showing that when people have elevated inflammatory markers, they tend to have lower magnesium. You give them magnesium, their inflammatory markers go down. To me, it's a no-brainer. Whenever I see anybody who's got chronic pain or osteoarthritis, I always encourage them to just top up their magnesium and their vitamin D and their B12, B6, and B1. I mean, I tend to do it with B complex because it's easier instead of taking 3 different pills. Um, a thing about vitamin D, there's a lot of variability among people in how they absorb and process vitamin D. Vitamin D receptor polymorphisms, as they call it. And so basically, the idea of trying to treat everybody the same with vitamin D is ridiculous. The idea of doing a study of vitamin D and not measuring the serum level is ridiculous because there's so much variability. And it's this controversial thing because some payers are refusing to check it, but like we can't know what it is without checking it. And you can have vitamin D toxicity if you take too much. To me, the wise thing is get your vitamin D checked, especially if you have chronic pain, chronic osteoarthritis, chronic other diseases. Get your vitamin D checked, even if you have to pay out of pocket if you can. And if it's low, support it and get some help making sure you take the right stuff. I've heard so many docs who like the person has a vitamin D of 12 and they say take 1,000 units a day. And that's low. That's a maintenance dose. If your vitamin D is 12, you need like 5,000 units a day and recheck after 3 months because there could be significant issues with absorption. So complex stuff, but these are important molecules that have various impact on the processes that generate pain, that generate osteoarthritis. Okay, collagen. I actually haven't been using collagen in my practice, but when I like researched to do this talk, I came up with all this stuff that I hadn't seen before about non-denatured collagen, which you can buy in various places. It's important to do some, investigation and get the right stuff. But collagen treatment versus placebo, this is again a meta-analysis, reduction in the overall WOMAC, meaning better pain, better, overall WOMAC, better. Decrease in the stiffness subscore, yay. Pain and functional scores didn't have so much differences. So what does that mean to you? It's hard to know. But they did find significant reduction in the overall pain scores with the collagen. And another collagen study, why did I include this? Yeah, because they had them walk and showed that they could actually walk better after taking collagen. And so that's good stuff. So probiotics, just one thing here. It's such a huge topic. We talked about the whole gut-brain immune connection and the biome, the health of your overall microbiome in your gastrointestinal tract has a huge impact on your overall well-being. The science is in its infancy because it's so complex. There's so many different kinds of bacteria, species and subspecies, and mapping it all out takes a really, really long time. But there's a ton of evidence that when things are out of whack, you tend to get more chronic illness. And so I just shared one observation here from kind of a review, and it basically came up with this observation that the advancement of knowledge in this area may pave the way for developing different probiotic strains that can be used to support joint health, improve treatment outcomes in OA, and reduce the huge impact of disease on healthcare systems worldwide. Great, that sounds good, but it sounds to me like they're thinking about what specialized patented drugs drug companies can invent, patented species of probiotic strains that they can invent and sell at large amounts of money to insurance companies. And what we also know is that there's tons of probiotics that you can get at what will probably be always more affordable costs. You need to be discerning. It's a really complex market. I can't give blanket evidence about it. I've got my preferences and my things that I do depending on what's going on for a person. I like to measure a person's biome with a DNA test and see what's going on in there so we can customize the probiotic intervention to address any particular deficiencies that there might be, especially those that have been associated with inflammatory states and pain states. So it's complex, but it's something that's important and something to keep an eye on as the science develops. So let's get to the practical thing. I'm going to have a sip of tea. I invite you to take a deep breath and just go, wow, that was a huge amount of information. I can't believe he's still talking. I am, and I will. There's a lot to share. If you have to leave, I'm going to try to get this replay up. I'm not sure when that's going to happen, but before too long. So whether you came into my world to this talk through Rose Wellness or through my private channel and my Facebook group or my own email list, I'll be putting the replay out to the people on my email list. And I think Rose Wellness will put it out to people on their list. And you can also watch my Facebook page, because I'll put parts of it out there and direct it, because Facebook doesn't, it's not good to put long things. So anyhow, to your health. So if you have to go, I understand. I'm going to keep talking and keep sharing, because that's what I do. And if you want to come back later and look at the second part of the replay, that also works if you want to do that. You don't have to make this oh my gosh, I need to hear it all. You don't have to hear it all now. So if it's enough for your brain to take right now, take a break, catch the rest on the replay. I think I'll probably be cutting the video here, right? And part 1, we just did it. This will be part 2, maybe part 3. Okay, so here's some things that I encourage you to think about. And because these are the things that over the course of 25 years of being open to an integrative perspective and seeing kind of the confusion and logical fallacies and what I think is often wrongheadedness and kind of like just, some people have a paradigm that's old and they don't want to think about new things. They want to think about drugs and procedures, and they're not open to hearing about natural products. It just doesn't fit their paradigm. So they look at the research, or they don't look at the research, but they just assume it doesn't make a difference and it's a bunch of hoochie-woochie stuff. That's one thing. And for that part of that reason, conventional medicine is very conservative. Doctors want to have a lot of research before they start recommending things, before they're going to make clinical practice guidelines that say use curcumin or boswellia or probiotics. They want to have a ton of research, and they want it to be vetted in a million different ways. And also, there's a thought process that like the old school needs to die out. The old guard, who are like the professors who are running those consortium and organizations that make clinical practice guidelines, they've got belief systems and they're not as open. And I've seen this in the research. I've seen, clinical practice guidelines that didn't really consider the research on polyphenols, or didn't consider the research and other things where there was significant evidence. They didn't even mention it. And so they talk about difficult clinical situations where you don't know what to do because the patient can't tolerate the drugs, but they don't mention the natural things, which have a much better side effect profile and a fairly good evidence that there's improvement there. So it doesn't really make sense. There's a mindset issue. And doctors might never get it. Some doctors might never get it. There's definitely financial incentives to do, there's less financial incentive to do supplement research because they're not as patentable. There are supplements that they patent, but mostly they're molecules. And you can't patent curcumin. You can make a specific kind of curcumin, but it's complicated. And so, what drives big randomized controlled trials is millions of dollars of money that drug companies get back. And if drug companies are ethical, it's great, because they're spending huge amounts of money in developing the science and giving us good data so we can know what to do. But we're learning more and more that a lot of times the drug companies are not ethical and they don't necessarily have the public interest in mind. And so it's just hard. The next thing I want to mention is that, as we talked about, it's a very complex process. From the point of view of looking at the biology, the process that makes sense to slow and stop OA and reduce the pain is a multifactorial process. And multifactorial research is really hard to do. You need huge data, data sets. It costs a ton of money to do multifactorial research. It's much simpler to just go, okay, this disease, placebo plus drug, boom. We studied 200 people. But if you have 6 different variables and all those variables have variables, it gets really complicated and people aren't doing it. So that's a big challenge. And then lifestyle approaches like movement, mind-body medicine, diet, and most supplements, they're very low risk things. And I encourage people to think with a risk benefit analysis, like, what do we know about the risk? What do we know about the benefit? I know that NSAIDs contribute to gastrointestinal problems, sometimes heart and kidney problems, especially in older people who tend to have osteoarthritis. I know that they tend to cause more of those problems when they're used for a long period of time, and this is a chronic illness. So there's a lot to say that NSAIDs aren't a good choice for osteoarthritis, just from a risk point of view. And then we think about benefit and we think, okay, NSAIDs help. We got a lot of studies showing they help. But wait, now we've got a bunch of studies showing that curcumin helps. Less research for curcumin than NSAIDs, but still a number of studies. We've got 2 different big meta-analyses showing curcumin works. So hang on a second. We don't have as much research as we do for NSAIDs, but the potential benefits of curcumin, not just the fact that they help with pain and function, but they're working on the underlying disease process. That's huge. It's a whole different paradigm. So it's important to think that way. It's important to think about risk benefit, to realize, okay, I went to this thing online and this doctor's talking to me about stress and how it can drive inflammation, which I haven't done yet, but I will. And so, like, should I learn to do stress reduction? Well, like, what does it cost you? What's the risk? Almost zero. What's the potential benefit? Potentially really big. Hello? How much research do you need to prove that? You need enough to get you in the game and start doing it. All right, I don't want to belabor that. I want to get practical. But these are some of the things that you should think about. So yeah, finding what works for you. That's what this is about now. One of the challenges that you can see, it can take a month to 3 months to see benefit in osteoarthritis. It's not like, oh, I've got a pain, I took a Percocet and I feel better an hour later. It's like, I've got osteoarthritic pain and I started glucosamine and I didn't notice anything for a month, but then gosh, my knees got better. So like if you don't try it out for long enough, you're not going to know if it makes a difference. And so to me with OA, probably best to use something for 8 to 12 weeks before you even decide whether there's a benefit or not. Second thing is finding a way to objectively assess it, because if you just say, okay, I've got these issues with OA, I'll start this stuff. My friend or this, I watched this talk, I'm going to start these things, but you don't really take a baseline measurement. And then 2 months later, you're like, how do I feel now? Oh, how did I feel? I'm not really sure, but you haven't measured it. Does that make sense? Like people come to my office a lot and they're like, oh, well, you didn't follow up for 6 months. How are you doing now compared to back then? I don't really remember. And it's the most normal thing in the world. It's nobody's fault. Like who remembers? We got other things to pay attention to. So that's why I think if you can find an objective measurement, and that's why I like the WOMAC, because you can get it online. I'll show you that in a second. Symptoms normally fluctuate. So again, like you might have good days and bad days. Somebody with osteoarthritis might like get a cold or a flu or a urinary tract infection, and then all their pain gets worse. And it's not that their arthritis is getting worse, but that they're sick. Or maybe they just didn't get good sleep for 3 nights in a row and their pain processing is hyped up. So those are important things. And so you can't look at day-to-day fluctuations. You want to look at the big picture fluctuations. And if you're in a crash at the moment because of some other thing going on, because there was a crisis in life, or because you didn't get enough sleep, or you got another kind of infection or something like that, that's not when you want to make your measurements. I hope that makes sense. And so, yeah, the WOMAC, I mentioned this before. Let's not go into too much detail, but just to say, like, it's supposed to be proprietary, but there's a million places. If you go WOMAC on Google, you'll find it. You can just like print it out and just like make a few copies of it. And before you start something, do the score and put it in a drawer somewhere, put the date on it. And then like 2 months later, do the score again before you look at the old one. Do the score again and compare them and see how he went. So that to me is a sensible way of deciding if something works. Now, it can be tricky if what you want to do is a multifactorial intervention. Because if you want to try, a few different things at once, like, okay, let me bump up my vitamin D and magnesium, and let me make sure my B complex is robust, and I'm going to add curcumin and fish oil because they work on parallel mechanisms. It's a really reasonable thing to do. So you're not going to know at the end of that period which one of those things helped you, but you might get even more benefit than if you only did one. And there can be synergy. So, it's a challenging thing. You got to decide what makes sense to your own values. Like, wow, I'm a go for it person, and these things make sense to me. So I'm going to try these 3 different things together at once, and I'm going to see how they do over 2 months. And wow, I feel so much better, and I don't have any other side effects, so I'm going to continue. Or not. or you might want to get help from a healthcare provider if you have someone who can help you creatively out of the box think these things through. So, how do I approach things? I encourage you to think about the three M's, right? This is just a construct I came up with. You see these three circles? And there are three M's, and one is mind-body relationships. One's your movement or motor system, and the other is metabolism. Mainly what we've talked about today has been your biochemistry, your immune function, your hormones, your biome, nutrients and toxins, really important stuff. But let's not forget that it's a brain-gut immune connection. And there's a bunch of elements to whether your overall state of being is in a place that feels safe and good, and whether you're marinating your cells in the biochemistry and neurology of safe and healthy and good, or if you're marinating yourselves in the biochemistry and biology of anxiety, disconnection, frustration, fear, overwhelm. Because we have the whole spectrum in life. And if you're spending a lot of time in frustration, fear, overwhelm, anxiety, disconnection, that's going to affect your biology. It's going to affect your biome. It's going to affect your immune functioning and your pain transmission. And so getting a handle on that is really huge and really important. Okay, same thing for your movement system, your muscles, bones, joints, connective tissue, and the nerves that serve them. We have evidence that osteoarthritis is associated with loss of joint position sense. We call it proprioception. There's evidence that loss of proprioception happens before degeneration, so that there's a way that like the body is getting disconnected from itself, that the muscles aren't tuned in to the nervous system. And that seems to be part of what contributes to the generative process, and certainly what contributes to the disabling process. I got a slide here at the end that maybe I'll show if anyone's still here, but it's kind of like, how does disablement happen, right? Something hurts. Well, I don't want to walk because something hurts. So I don't walk. So my muscles get weaker. So I tend to be in more pain when I use them. We got a lot of evidence showing that strengthening your muscles, especially your quadriceps and your hip stabilizers and your core strength, that's really important to maintaining your well-being in general, but to preventing progression of osteoarthritis, because the body is one unit. Your muscles are endocrinologic organs. It's so complex. I'll talk more about this in a bit. The point that I'm really getting to, the point of this slide is that if you really want to deal with osteoarthritis or any other chronic illness, it's so important to think about these three main elements. They're interlocking circles: your mind-body relationships, your movement system, your metabolism, and those three circles meet together in the middle, and where they meet is where your life happens. I've got this little glowing orb in there because, there's something beyond what we can measure. There's an aspect of us which is beyond measurement. And whether you want to just call the stuff that science hasn't figured out, or if you want to call it your soul, if you want to call it your connection to divine spirit, like, these are real influences. And it's important to actually incorporate that in your well-being too. So that's where it all happens. Okay. So things you can do to slow disease, reduce pain, increase function. We kind of talked about this already, but elimination diet, we didn't talk about that. We'll come back to that. We talked about Mediterranean diet and physical exercise. And look, I'm a big fan of traditional physical therapy. I'm a rehab doc. I've been collaborating with PTs forever. Most of them are amazing, great people who are in it for the right reasons, and they're really good at helping you get fit and stay fit and guiding you and helping you avoid injury and all of that. And good PT, look, there's crummy PT and there's average PT and there's great PT, and they're totally different things. So finding a good physical therapist can be great, and learning a good exercise program to maintain strength and balance. But Tai Chi is another thing. I'm sure you've heard of that. It comes from martial arts, but it's a slow meditative movement. I teach an online Tai Chi program because it has so many profound health effects, and there's so much research showing its benefit in osteoarthritis. What happens in Tai Chi is you learn to move more effectively. You learn to move more smoothly with more proprioception or joint position sense. You move in a way that's relaxing and calming. I see a lot of people go to the gym and they're taking their stressed, disconnected, struggling, I'm not enough, frustrated, scared mindset and getting on the treadmill with it. And they're watching the news on the treadmill with that mindset, thinking about all the bad things going on in the world. And like, they're missing the big benefit of exercise, which is turn off your mind, get into your body, get into a more quiet meditative space. You know, a lot of people have a distractible mind. I have people in my meditation classes and especially in my Tai Chi program who are so distractible, but they do the Tai Chi, and because there's something to do, the mind just calms down. And that's part of the benefit of Tai Chi also, is that you bring your mind into the body. So the mind gets quiet, the body gets quiet. You're exchanging information of mind body that is quiet, calm, present, and you're strength training and balance training, and it does a lot of good things. And then individual supplements, like we talked about it. Elimination diet's another whole world. I'm not sure how many of you've heard of that, but the whole idea is that if you've got a significant widespread pain, fatigue, exhaustion, obesity, chronic illness, you might have some dysfunction in your gut. And if you got a lot of gut symptoms, it's even better likelihood. Irritable bowel, constipation, diarrhea, gas, cramping. There could be stuff going on there, and there can be food sensitivities. And really the best way to find out if you had food sensitivities is stop the things that are most likely to be the offending agents for a month, and then restart them one at a time for a week. Briefly, that's an elimination diet. There's subtleties and details, but most of the patients I see, especially with widespread chronic issues, we do an elimination diet. And for many of them, it has just a huge impact. Getting off the sugar, getting off the gluten, getting off the dairy, sometimes corn, sometimes soy. Most soy is like GMO hit with so much like awesome, potentially toxic pesticides and fungicides. Like commercial grown generic soy is probably not healthy food, but it's a massive part of our food supply. So anyhow, those are the big five. There's others that are sometimes relevant for people. I'm not a big fan of those fancy tests because they have so many false positives. Wow, okay, so we're like at an hour now. I just want to acknowledge it's been a long talk. I'm going to keep going. Whoever wants to stay, you're welcome. We're going to cut it up into pieces later. Yeah, heal the gut and reduce inflammation and oxidative stress. That's the game here. That's what stops the process. That's what slows the process. And that's what has an impact on all those other diseases that go along with osteoarthritis. So if those are relevant for you, this is relevant for you. This is sort of the take-home slide in terms of the nutrients we talked about. I see some of you are taking pictures, which is fine. Grab that screenshot. This is what I typically recommend for people. I'm not recommending this to you because I don't know you. I'm saying this is what I recommend to people. Some of these things are what I do in my own life. Like I said, I'm also dealing with early osteoarthritis. And so these are not medical advice to you, but they are reasonable things, and they reflect what's shown and studied in most of the studies. So you can see what these are. We didn't talk about SAMe. SAMe is a methyl donor. It's got a bunch of physiologic processes that affect pain transmission, neurotransmitter synthesis. There's a bunch of early studies on SAMe from like the 1980s and 90s, but not so much in the past 20 years. In part, I think, because all these other things are showing so much more benefit, and maybe because they're more patentable, I'm not really sure, but some people get incredible benefit from SAMe. It is a little bit more expensive. Some people get a headache, but for some people, it makes a huge difference. So hopefully that's self-explanatory. The rest of it, I mean. People who want to consult me can do it through Rose Wellness or through my private practice. So I'm just putting this up there, like if you want to think these through. And then I also do a lot of teaching online for self-healing. I'm not done with the presentation, but these slides, here they are. Like teaching more knowledge about this stuff through blogs and videos, and also teaching self-healing skills. This is a big part of what I'm committed to, because I feel like, the impact I can have in terms of helping benefit you and the world are by helping everybody heal. And healing's an inside game. It's not just about the supplements you take. It's about the way you move, the way you think, the way you relate to yourself, and the well-being that you develop from the inside out. And so I'm really big on that. It's really important. Okay, so what do I do in my practice when I see patients? This might be interesting to you, it might not. Let's see. So first of all, we talked about all these disease processes that are driven by the gut-brain immune axis. So I frequently see people with a lot going on. Sometimes it's isolated osteoarthritis. Sometimes there's also irritable bowel or fibromyalgia or fatigue or other chronic pain. Sometimes there's autoimmune illness or rheumatoid arthritis. And so I spend like usually 90 minutes with new patients. I try to look at how widespread are the joint issues. Is this a really systemic florid inflammatory osteoarthritis picture? Or is it just the knee because the person like really damaged their knee when they were in high school playing football? And then look at the whole picture of, of the individual based on a really deep history, symptom inventory, conventional labs, and really thinking about all the different systems of the body because they give clues as to where those underlying biological imbalances are. Part of the history is like what happened in the womb, what happened in early life. That's what sets up your fight, flight, freeze response. That autonomic nervous system is frequently conditioned by early life experiences. Um, did the person have some sort of inflammatory disease or allergic disease early in life? Was the person breastfed or not? A lot of these things have implications for how healthy your biome is and whether or not we need to think and worry about that. Um, the person who comes to me who developed widespread pain and osteoarthritis after they were in Asia and they got some sort of horrible infection and they were sick with a gastrointestinal bug for 3 months and they've never been the same. Or the people who have had various stuff going on and they got COVID or they got the vaccine and then everything just kind of, you know, tumbled and got worse and spun out of control. And that's because those infections can set up changes in the gut-brain immune function. They can set up changes in various other bodily systems that kind of propagate through and get stuck. And so we want to know what those things are so we can think about how to address them at a root cause level. And so we think about all these different systems of the body and how they interact with each other, because this is what gives rise to all those diseases that the ologists look at. I like to tell people, just explain that like disease is this like process flowing downstream over time. It doesn't happen immediately. You don't get fibromyalgia overnight, although you might have symptoms overnight. You don't get osteoarthritis overnight, although the symptoms might get worse after that infection or flu or who knows what. But the process has been flowing downstream. And what we're trying to do is actually get the stream to flow backwards to a certain extent and try to unravel this process of these biological imbalances, frequently starting with that gut-brain immune interaction, and then thinking about things like, you know, energy function and hormones and transport and all these other aspects of your biological functioning. So that's the sort of theoretical foundation of it. And of course, I work through this, what I love about working through Rose is that there's a really great health coach, counselor, nutritionist we work with who helps people make dietary changes and helps people be consistent about lifestyle changes. And so frequently I'll have advice or things that I recommend people want to do, but we all know that advice doesn't necessarily translate into action. And you need to review it. You need to create accountability. Sometimes you need to see it and talk it through with someone and figure out what your ambivalence is. And it's normal to be ambivalent about dietary change, exercise, meditation. Like sometimes these things just don't seem normal. But if you think it through and think, okay, why do I want to do this? Why do I not want to do this? What really matters to me? What are my values? And I feel like as a practitioner, that's part of my job is to help you come to that place of making good choices for yourself. And so the health coaches that I collaborate with are part of that effort as well. So gut healing, right? Because it all comes down to that. We tend to go with these 5 steps, remove the bad stuff, replace the missing stuff, re-inoculate the biome, repair the lining, and then rebalance the brain gut immune system. So I just want to unpack these a little bit because I've heard a lot of people say, well, I've got irritable bowel and all these other things going on. I stopped gluten and, it helped for a little while, but then it kept going. I'm like, okay, great. So you stopped gluten and it helped. That means you're probably gluten sensitive, but it could mean that your biome's out of whack. It could mean that you got leaky gut, and just stopping gluten doesn't give your body what it needs to fix that. You got to help your biome. You got to see if there's other food sensitivities that might be bothering you. You may, because of irritability of your gut and what the gluten was doing to you, you may have not been absorbing nutrients for a long time. You may be on medications that prevent you from absorbing magnesium. So you might have a pro-inflammatory state. I didn't mention that before, right? So like, just as an aside, so we all know about the anti-acid drugs like proton pump inhibitors, right? Omeprazole, the classic one. And so what we learned to do back in the 1990s, okay, we're worried about the NSAIDs giving the person an ulcer, so let's give them omeprazole. Well, what we've discovered is the omeprazole causes leaky gut along with the NSAIDs. Omeprazole prevents you from absorbing magnesium. We heard before, magnesium is anti-inflammatory. So there's so many subtleties to transitioning from like a pharmaceutical approach to a natural products health-oriented approach. Okay, so that was a little bit aside. In any event, back to this, re-inoculating the biome, removing the bad stuff. Oh yeah, so, you know, the whole gluten toxicity thing came into vogue in studying celiac disease. And so a lot of people will go to a GI and find out that they have actual celiac disease as opposed to non-celiac gluten sensitivity, which is a thing. And they'll stop the gluten, but they don't get taught about fixing all this stuff. And even in the studies, you know, they show that people who stop gluten, their gut doesn't get more sick, but it doesn't get better. And the comorbidities of gluten sensitivity, like Hashimoto's thyroiditis and hypothyroidism, don't get better. It's because they're not healing the gut. So we take a comprehensive approach of healing the gut so that the gut-brain immune functioning go back towards normal. Yeah, and here's some of the things that we use. I don't want to go too into this. It's a whole process, but that's the process. And a lot of emphasis on mind-body care for the reasons why I expressed before. Okay. All right, so my friends, let's just run through this to the end. I thank you all for being here, and thanks for listening. I hope this has been useful and interesting. There's so much to talk about on this. I could talk for hours, and I'll probably make more videos about it. Feel free to tune in. Feel free to check out not only what's on my Facebook page, but also my video blog and YouTube channel. Those are available if you're interested. I'm going to pop up and look at the chat for a second. I can't really see it from where I'm sitting, so I'm going to be off screen and I'm going to look. I'm seeing, thank you very much. You're welcome very much. Someone says I'm a hero, and I think I'm just a regular guy, but thank you. Sorry you have to leave too. I appreciate you being here. What's the relationship between osteoporosis and osteoarthritis? Oh, that's a good one. And then I agree, very much appreciate you got an ulcer from NSAIDs. Right. And then Carol says, this has been great, but I'm grateful for your expertise. Wonderful. Thank you, Carol. I want to answer a couple of these questions. Osteoarthritis and osteoporosis are two different processes, but like I said, underlying shared issues, right? Gut-brain immune function, inflammation, oxidative stress, making the body sick. And there's a lot of overlap in those processes. If you talk to the average sort of medical head, you're going to hear, oh, well, osteoporosis is a different process than osteoarthritis. If you take it back to the core driving variables, there's overlap there. Hopefully that makes sense. You could say the same thing about a number of different chronic illnesses. I was trying to make that clear early on. Thanks for asking. Okay, I'm going to wrap it up, folks. Thanks so much for being here. And I look forward to seeing you around in cyberspace or who knows where, and wishing you all well. Take care.